Welcome to Frontline. So as the pandemic has made its way to the entire world, including Africa, various governments have taken a number of initiatives to prevent the spread or at least mitigate the outbreak in their various countries. Among these were health education messages to members of the public on personal counter measures required for the prevention of infection, establishment of testing centers, enhanced surveillance and contact tracing, among others. Ghana was no exception. West African College of Physicians is raising concerns about Ghana's testing capacity and response. Dr. Albert Akpalu is the Secretary General of West African College of Physicians. He joins me via Zoom for a discussion. Hi, Doc.
Hi, good afternoon.
Good afternoon. Thank you so much for joining us.
Good.
I also have...
Okay.
Yeah, I also just was going to say
I think
that
I'm here with my vice president for the Ghana chapter, Professor Alfred Yosin. I think I can see him live.
Exactly.
On Zoom.
So I was just going to introduce him as well. Professor Yosin, thank you for joining us.
Thank you for having us.
Okay. So let me start with some of the observations that your association has made since the outbreak of the virus. If you can summarize it for me briefly.
Okay, so I think we are the West African College is happy with what the governments in the sub-region are doing, especially in going forward to put these lockdown measures in place and also to mitigate the social impacts of this lockdown. But however, we still have a few concerns which we need to ramp up, especially the availability of diagnostic centers. As you reported in your news today, State Hospital has to be shut down because they've had 2 cases who've been there for a whole week.
Yeah.
And there are similar stories around the place. So we need to improve the speed of testing and have real-time results. So when somebody comes in and is positive, we're able to move him to an isolation center and ramp up his treatment. And of course, we have to protect our health workers. Provide adequate PPEs, and there's a lot of black marketing going on. Prices, PPEs are not cheap, so I feel sorry for some of our institutions, but we have to protect ourselves, and there should be no. We should not cut any corners for that too as well, and we need to build on our capacity. Ebola has come and gone, and I must state that there have been other highly infectious diseases like Lassa fever and Ebola, which are still ravaging the sub-region. So we need to improve our capacity. So we as specialists across the sub-region are available. We are already on the front line and we want to remind the government that we are here to help and we are here for the long term.
So one of the things you mentioned that caught my eye is black marketeering. You say that there's a lot of black marketeering. What exactly does that mean? And what sort of evidence?
Price of a gown before COVID maybe was 5 or 10 cities. Now saying at 85 cities. PP, the face masks are selling for 10, 20 times the price. So I think government needs to come in and try and bring down some of these prices so that the hospitals can survive.
Okay, let me bring you, Prof. Yosin, in this discussion. What exactly, do you have some sort of recommendation that government can follow in this time based on the concerns that you're raising?
Yes, certainly. As Dr. Akpalu said, the key to fighting this pandemic, one of the major issues have been the testing. And we are happy, for example, in Ghana, more testing sites are coming on board. However, we still have challenges receiving results, especially for clinical care of patients and for health workers as well. You take samples and it takes several days. And you can see if you are to quarantine 70 or so health workers, who else is going to be on the ground to provide service? So as much as possible, releasing test results and getting them as quickly as possible will help health workers to provide service not only for COVID patients, but for non-COVID services as well. And also, generally, to release the effect and the trauma that people go through whilst waiting for test results. So testing has been a major challenge. A lot of effort going into improve that, but we still have quite a lot to do in that regard.
Right now, we were just yesterday, for example, you've spoken about testing. Last week, or I think about 2 weeks ago, there was a news report that we did indicating that some easy to handle test kits have been developed. I mean, has your association taken notes of that particular development, and what do you think of it?
Yes, there are so many unknowns about the current pandemic, and therefore we are very careful in what we will recommend.
All right.
Currently, what we recommend is the PCR testing for the antigen, the organism itself. And we believe for now, in the current phase of the pandemic as at now, that is the most useful test that will help us. And therefore, all effort must be made towards getting a lot more centers doing the PCRs for now and getting the result quite as quickly as possible. Other tests may come on board and may be useful as we progress in the pandemic, where we would like to know whether people have developed antibodies, whether the body itself is able to fight the disease. But for now, to be able to diagnose and isolate and treat, we need a PCR, and I think that's the way we ought to go, and all efforts should be geared towards improving that.
Dr. Akpaloo, I'll bring you back in. How is the West African College of Physicians involved in this fight? To what extent are you involved?
We are central. We are central to this fight in that we are an association of physicians, specialists across the sub-region. So we are pediatricians, we are internists, we are laboratory physicians, we are public health workers, we are community health physicians across the sub-region. So we are in all the 13 out of the 16 countries in the sub-region. So we are leading from Professor Yosin is a public health physician in the community health department.
Okay.
He's integrally involved in contact tracing. We are on the front line at Kolebu Teaching Hospital in looking after these patients as well. But across the country, across the sub-region, all our fellows and members are intricately involved. So once the governments know that we are there, we are supporting them, and we will lead the fight and improve our health in business as we go along.
Okay, I just want to find out from you, one of the things, one of the revelations that came up at I think the last but one press conference on COVID-19 was that the other diseases or other conditions that would have taken people to the hospital, attention to it is waning. So everybody, the focus is on coronavirus. How are the other parts of healthcare delivery being affected, and what can we do in these times?
Yes. So currently there's a phenomenon going on. Everybody is saying COVID. But COVID is hiding behind lots of other conditions. So we have people coming with their normal heart failure, strokes, liver diseases. Children are coming in with their malaria, meningitis, and etc. But also testing positive for COVID. So there's a big dilemma now. How do you tease out the two? Are we going to have hospitals designated just for COVID and non-COVID? But it's difficult to tease out the two because we're having the test coming in a week plus 5 to 7 days or 5 to 9 days. So somebody comes in with a chest infection, for instance. Do we have real-time testing to say, okay, this is a chest infection, it's likely to be an associated COVID infection, so isolate him, send him to a treatment center. Currently, unfortunately, this is not happening. I can say in Kolebu, if a case is suspected from the emergency room and the test is taken, we have to send him to a holding place, which is not big enough. Yeah. The treatment center in Kolebu is only 6 beds, range is only 5 beds. So we're having loads of patients coming in and having other diseases, strokes, heart failure, everything, that also are COVID suspected. So what do we do? Do we give PPEs to everyone? No, it's difficult for the hospital because if a case is suspected, I have to wear the full PPE, I have to wear my gown, I have to wear my mask, and those gowns are damn hot, very hot. You cannot be in them for more than three hours maximum, and you need to be changing them on a regular basis. So it is difficult now for our hospitals. So for now, we are advising our health workers, every case is a COVID suspect. So use your PPE, protect yourself, wash your hands, wear your appropriate mask, wear the gowns if they are available, and we have to find a way of not I'm not going to say reusing, but having the appropriate PPEs for appropriate levels. So yes, people are dying at home from their strokes or from other illnesses because they are afraid to come to hospital. So that is it's like between the devil and the deep blues.
I know, right?
People are afraid to come. People are having their conditions. The COVID is masking some of these conditions, and the COVID is a multi-system disease affecting I'm a neurologist. We have cases with strokes. It affects the heart, affects the lungs, affects the kidneys, affects the liver, affects your gastrointestinal tract. Some of them come with diarrhea. So it's a mixed match. So for us as physicians, specialists, every case that comes into the hospital should be considered as a COVID suspect and treated as such. So that means that we have to ramp up our testing. We need real-time testing so that if I see a case, I think this is COVID, the test is done, results come in real time, and I can decide that this is what we are going to treat him on. So we don't do any trial and error, and we go according to the protocols that the Ghana Health Service and the Ministry of Health have set for us to do.
Totally agree with you, and we've had a typical case from what you're saying at the Trust Hospital this afternoon. A typical case where, I mean, Trust Hospital, most of my colleagues go there, I go there myself, and again, like you're saying, that is going to just increase the apprehension with which people want to go to the hospital. So I, for instance, had it, I was discussing with my colleagues, and I said, oh, but I just went to this hospital like last month or last 2 months now, and I'm feeling like, okay, should I go there again? But the good thing, like my friend, our head of the health desk was saying, is that they have other branches so that people can go to the other branches. But for frontline workers like yourself at Kolebu and also you, Prof. Yilson, I want to find out from you how this has been for you, the COVID period we're experiencing has been for you personally. How has it changed your life? What sort of stress is it putting on your system? And how are you dealing with it and working around it? Let me start with you, Prof. Yilson.
Yes, it's been a challenging period for all frontline health workers and all health workers in general. A period of uncertainty, but we still must do the work. And the little we ask for is the protection for our health workers, so the PPE. And when these are absent, health workers are forced to do the things they have to do, and that is quite difficult and sometimes traumatizing. So it's not been easy, but generally health workers have been doing quite well. Psychologically, physically draining, and sometimes you cannot just do some of the things you need to do. You get home and there are some things ordinarily you would have done, but this time you just can't do it. You need to try to avoid direct contact with kids, with family members, unless you do a few other things before, even where you enter the house from and all that. But in all this, we are trying to do our best, and we don't let it get to us very much. All we ask for is the little protection that we can be offered in terms of the PPEs, in terms of the systems that need to be put in place, like Dr. Palu said, getting the test results early so that we reduce some of this trauma for health workers. Yeah.
Okay, and talking about that, did Doc say you are a pediatrician? I just wanted to make sure.
I'm a community health physician.
Community health, okay, right. And he said you are a public health person, right?
Yeah.
And so I want to just put this quick question to you before I go to the personal one with Dr. Palu about the concerns that people are raising. I mean, just this afternoon we told a story about how the minority is asking governments to open up and allow people to come in. I mean, open up our borders. This afternoon, government held a press conference, and the Deputy Information Minister said that's something that's been considered. From a public health perspective, looking at the time, the period within which we are, is that a decision that we should even be talking about now, opening up the borders?
From the public health perspective, we will not encourage that for now. We need to contain what we have within our borders now, and get a handle of that. Continue to contact trace, continue to test as many people as possible until we are certain and where these people are coming from as well. If we are certain other places, the incidents or the new cases of the infection are going down and we are a bit comfortable. But for now, it will be difficult, and we will not advise that we do that. We still need to keep our borders closed for the time that we have set for ourselves until we see our way a bit clearer. That would be my advice.
I appreciate that public health perspective that you put in. Dr. Pali, I'm coming to you. Before we do the public health perspective, talk to us about the personal toll that this pandemic is taking on you as a frontline, as someone who's working at Kolebu of all places. How's it going for you?
So it's been quite a revealing experience for us. Ebola tried to come and it spared us, so we were ready, but we didn't really get into it, but it ravaged across the sub-region. And then Corona came, so it has really changed our way of life. My wife is a senior specialist in Kolebu too as well, so it's two of us at home, so we've had to change our way of doing things. So I have shoes in my boots that with sanitizing, we have to change before we come home. And our kids test us before we enter the house. So they check our temperatures. We have to sanitize, leave our things outside. We have to wash things separately. And we did our test last week. So before it took us some time to get the results. So I'd actually packed my things, ready to go to an isolation center. The results came. So we have to cheer ourselves up. It's tough on all the health workers. We are human. We are afraid as well because they are asymptomatic people who are shedding the virus. So that's why we all have to wear our masks wherever we are going. Today I entered a place, I forgot my mask. I had to go back. No masks, no entry. We need to get the appropriate masks. People are using all sorts of things. I've seen funny pictures on Facebook and the internet. Somebody actually put a Bible and tied it around. I know the word of God is powerful, but the word says wear your mask. So let us wear our masks, wash our hands, and let us be nice and kind to each other. People are suffering. It's hit a lot of economies. The hospitals are the hits. OPDs have gone down. People are afraid to come. Elective surgeries have been stopped, so people are not having the surgeries that they should. And it is affecting everything, economically, financially, spiritually. Our churches have been hit, but we are having virtual churches. So I think we as the college are encouraging governments to continue with the measures. We encourage governments to let everybody wear masks. That's the only way we can stop the community transmission. We need to increase testing so that we who are looking after patients, yes, I was negative last week, but what about next week? If I come in contact with you who is being to somewhere, we should stop the stigmatization. Let me use these opportunities we should stop the stigmatization. Because I work in Kolebu or I work in anywhere, that does not make me. I've seen some of my friends say, "Hey, COVID doctor." I said, "No."
They call you COVID doctor?
Yeah, because I work in an institution, and we see some of our colleagues like that too as well. So yes, physical distancing, hand washing, wear your masks, and let us encourage each other. This too shall pass. But
it certainly
when it shall pass, we do not know.
It certainly will. And along the line, I'm sure that we can always be checking up on you here. This segment that we've created on this show is for people at the front line like yourself. We take the time to, get your reflections, talk to us with all your problems. If you need someone to listen to you at least, and also to draw attention of the authorities. So certainly, I'm sure we'll be checking in on you again one of these days. But just quick one before we go, the thought of opening the borders as a health personnel, does it scare you that we might end up having our health institutions overwhelmed if we do? That is part of the decisions we shouldn't be talking about at the moment.
So I actually feel sorry for So all our Minister of Health, the President, and everybody who has to take that decision by Sunday. But as Professor Yosin has said, in the public health perspective, we should be locked down till further notice. But our economy is going to suffer. What other measures do we have to put in place? So we encourage government to take these social mitigation and other policies carefully, right, and weigh the pros, the benefits, and weigh the pros. Yes, if we open our borders now, we get an influx, we're going to have a second wave. Our officials say the cases are coming down. Yes, but we have 25 million plus. We've tested just a fraction. What about the asymptomatic cases? How are we going to catch them? When you open a school and just one asymptomatic person enters and spreads the virus, that's it. The virus has a different way of manifesting itself in different people. I can have it and be fine, and somebody next to me can have it and die the next day. So it's a big risk, it's a big gamble we are taking. My advice to government is wait a while. Listen, yes, but tarry in making that decision to open the borders.
Okay. It's a big risk. It's a big risk and a big gamble, is how you put it. And I appreciate you taking the time to share your concerns with us. Like I said, on this segment of this particular show, we focus on frontline workers like you. Thank you so much, and keep doing the work that you're doing.
Thank you very much for having us.
Everybody that watched this show is grateful to you for the work that you're doing. We'll always be here to amplify your voice. Anything it is that you want us to talk about, we'll be here to give you that platform. I've been talking to Professor Alfred Yosin, Dr. Albert Akpaloo. They are representative from the West African College of Physicians, but I mean, they are physicians on their own. This is Frontline.